The NiTiBOND prosthesis is delivered in a closed triangular box together with a thermo dummy. For removal and transport of the prosthesis, a sharp instrument is needed, for example a hook or a needle, and titanium tweezers. First, the laser with which heat is applied is calibrated. The thermo dummy is used for this purpose. Using a sharp instrument, the safety pin of the thermo dummy is first removed by pushing it through fully downwards. Then the thermo dummy is tilted up at the loop using a fine hook or titanium tweezers until it snaps into place in a vertical position. Starting with the lowest output setting on the laser, a test can be performed to determine the optimal settings for reliably closing the loop. When calibrating the laser, please follow the sequence spot 1, spot 2, spot 3. After optimally adjusting the laser, it can now be used to close the NiTiBOND prosthesis. To take it out of the triangular box, the safety pin is removed with a sharp instrument. Then remove the prosthesis using the titanium tweezers. To do so, grasp it in the center of the piston. Now place the prosthesis in the hole provided in the triangular box and orient the loop in a suitable position for insertion into the middle ear. To secure the loop of the prosthesis on the incus, heat must be applied with the previously determined settings for the laser. First, the upper thermoactive zone of the prosthesis loop is activated. Then, the second laser shot is performed on the middle thermoactive zone. Finally, the NiTiBOND loop closes with a laser shot at the third thermoactive zone. The NiTiBOND Stapes prosthesis is now securely closed around the incus process. Kurz, middle ear intelligence for more than 30 years.